A pointer for new physicians to keep in mind is to always include the patients in the plan. The patients are the one that has to follow the plan going home, and if they're not on board with the plan, it's going to be very difficult for them to be compliant. I've discharged patients before, let's say they're supposed to start on new Coumadin, which requires a lot of monitoring and lab work and dietary control, but the physician hasn't mentioned any of that to the patient before, and they might have difficulty going to lab every other week because they don't have transportation or some of the social issues that, they can't control their diet as well. So it's very important to include the patients in the middle of the plan for best patient care. As a physician, if you're able to, spend the time and include the patient in the decision-making process versus just telling the patient that we want you to do this, this, and that, it's going to go a long way for patient compliance.
Physicians can most definitely work collaboratively with pharmacists to minimize errors. We all know that medications errors are very common in our healthcare setting, and we have to all work together to minimize these. I can think of multiple situations where I have worked with physicians to minimize errors. Actually, attending clinical rounds probably helps in minimizing a lot of errors because I get to hear about patients' progress. I get to work with the medical teams collaboratively to come up with medication therapies based on their assessments. This helps a lot because I can openly communicate with them without having to guess when I receive an order what this medication could possibly be for.
So it's very important that you communicate with the pharmacist in terms of patient care, where we are with regard to our list of patients, and where you are to make sure that we're all on the same page and to make sure that nothing falls through the cracks. When things get busy for me in the hospital, then it depends on where I am. If I'm down in the pharmacy, it's literally, you can call the pharmacy, you can ask to speak with me, and you can let me know that you have a question about such and such patient. And then I usually always advise people to just ask permission for, say, are you ready to talk about it right now? Can we chat? And then I think it allows people to shift. So I think that's very important. When I'm up on the floor working hand in hand, then the best way to do that is to come in and say again, hey, Nancy, I'd love to debrief with you on our patients. Do you have a moment? If you don't have a moment right now, let's find some time when we can do that.
There are a lot of different drugs and there's a lot of different reasons to take the medications. And for certain medications, they have different doses for different indications, and it can get kind of tricky. For example, let's say there's a pain medication. The doctor might write Tylenol as needed for pain, oxycodone as needed for pain, and then Percocet as needed for pain. But as a nursing staff to administer the medications at the hospital, if a patient has pain, the Joint Commission doesn't allow the nurse to choose which medication. It has to be very explicit. For moderate pain, you use this medication. For severe pain, you use different medication. So those all have to be clarified in the order, making sure that the physician orders it correctly so that the patient gets the correct drug. In my experience, maybe about 10% of the time, I'd have to contact the physician to make sure that the dose, route, and frequency is correct as written. If we don't have to spend time to clarify the medication dose, route, and frequency with the doctor, then it can improve patient care and making it more efficient so that the patient could get the medication on time.
I think it's very important to remember that pharmacists are an incredible resource for you. So it's always useful just to quickly call up the pharmacy and say, hey, I'm about to enter this order. Is it going to be an issue? Will there be a delay? And that's how you then begin to learn from an efficiency standpoint exactly how the pharmacy works. What comes through, what doesn't, and it saves a lot of time. I remember when I was a resident, I had one resident who would call us, hey, Gary, what do you need? I'm trying to figure out how to enter this order because I want to make sure my patient has it, this or that. But Gary, within the first few months, knew that hospital front and back when it came to pharmacy because he learned how we did things and he learned how it worked. So in summary, work with your pharmacist, use us, we're a resource. We love to answer your questions. If you meet a pharmacist who isn't interested, there are many more who are. So definitely tap into the resource, especially if you're on rounds and you have clinical pharmacists as well. They're an incredible resource who will make your job a whole lot easier.